Hi, thank you all for coming here today. My name is Emily Moore, and I have a background in dietetics as well as physical therapy. And today I'm going to be discussing with you the bariatric procedure known as laparoscopic adjustable gastric band, also known as lap band. So first, what is lap band? It's a bariatric procedure that reduces the capacity of the stomach, which limits the amount of food a person can eat at one time. The surgery is minimally invasive, it's adjustable, and it's also reversible. So it's a great surgery compared to other bariatric surgeries where they actually require removal of parts of the stomach to make it smaller. And this lap band also has 3 parts, which I want to go over with you. I just have this picture here to show you. So first, you have the adjustable band that goes along the top of the stomach here, which creates that pouch. You have this silicone tubing here, which then connects to the access port. And the access port is placed underneath the skin, and it's right on top of the abdomen. And the doctor will use this access port to inject saline into the tube and then into the gastric band. And that will inflate the gastric band, and that will actually be what creates this pouch. So, who may qualify for this type of procedure? So for lap band, people who have unsuccessfully tried to lose weight in the past and have not been successful, so they've tried diet and exercise and it just hasn't worked, they may qualify for this procedure, but they would also have to have a BMI of 40 or above. And according to the FDA website, the FDA did approve the lap band surgery in 2011 for patients who have a BMI of 30 or above, but also have a comorbidity as well. So if they have diabetes, heart disease, or hypertension. And I included here just a chart to show you the different BMIs and what it means. So as you can see here, a patient who has 40 BMI, they would be considered morbidly obese, and they are at extremely high health risk. And those patients that have the 30 BMI or higher, they are considered obese, and they do have a high health risk as well. And just to go over some of the desired outcomes for this surgery, so obviously you would want to decrease the overall body fat composition of the patient, and there should also be a decreased risk for comorbidities, so that's the hypertension, the heart disease, and diabetes. And there should also be a 25% decrease in the excess body weight by the 2nd year after the surgery. And that's considered satisfactory. There's also some adverse effects to the surgery. The most common one is the acid reflux, which is seen in almost all patients that undergo this procedure. They may also experience the band slippage, obstruction of the stomach, dilation of the esophagus, infection, nausea, and vomiting as well. And I just wanted to include here a study just to show how effective this procedure really can be. So this study that is entitled The Treatment of Mild to Moderate Obesity with Laparoscopic Adjustable Gastric Banding. And this surgery took 80 patients that were 20 to 50 years old with a BMI of 30 to 35. This was a 2-year-long study, and I've divided the patients into 2 categories. So they had one group that underwent the laparoscopic, and then they had another group that was non-surgical, and that group was just placed on a low-calorie diet, and they were asked to exercise 200 minutes a week. And so that was kind of considered the baseline to compare the surgical group to. And according to this study, they had 33 of their 39 surgical patients lose more than 50% of their excess weight in 2 years. So that is a very significant number. And they also report that all 39 surgical patients achieved satisfactory weight loss, which again is at 25%. The non-surgical group also, lost weight. They had initial weight loss of 5.5, and they had a total weight loss of excess weight of 21.8%. So they didn't have as much weight loss as the surgical group, but they did have some. Unfortunately for the non-surgical group, they did have progressive weight gain after 6 months, so they had a much harder time keeping the weight off compared to the surgical group. The surgical group also had some health benefits as well. So they had improved diastolic blood pressure, improved fasting, plasma glucose levels, improved insulin sensitivity, and also improved HDL cholesterol. The study also reported some of the adverse effects that they had, which were port site infection, acute colitis, and prolapse of the band. And here I just wanted to include a case study. So this case study looked at a 24-year-old female who had a BMI of 43.4, so that does put her in the morbidly obese category. And she had a starting weight of 245 pounds. And she had this procedure done in May of 2008. And just to show how effective this was for her, she did lose 15 to 20 pounds in the first 3 weeks. And then her lowest weight after the surgery was 150 pounds. And her current weight is at 170 pounds. After all these years, she has been able to keep most of that weight off, and so she's been very successful with this procedure. And just to show you what's required of these patients after the surgery, as far as diet is concerned, they are put on a liquid diet for the first 2 weeks, and then by the 3rd week, they are allowed to have soft foods. That includes things like yogurt or scrambled eggs. And they're also asked to avoid fatty foods. With this procedure, you do see the acid reflux, and some patients do have issues with their gallbladder. So avoiding fatty foods can really decrease the risk of having those issues. But unfortunately for this patient, she did have some serious complications. So she did have the cholestasis, which formed 3 months after surgery, which resulted in having her gallbladder removed. She also reported that she had difficulty eating spicy foods, and she does have the acid reflux as well. But other than the weight loss, she did have other great health benefits as well. She said that she's able to live a more healthy lifestyle. She is able to run 3 consecutive miles, which she was never able to do before. And she also has improved mental health. She said she feels more confident and she has more self-esteem. So obviously, looking at this case study and the study before, this procedure is very effective. So I would highly recommend this surgery for patients who are severely overweight and have not been able to lose weight the traditional way. This procedure is minimally invasive. It's a great procedure compared to other bariatric surgeries that are out there, and it requires very little downtime after the surgery. So once again, I would recommend this surgery. And does anyone have any questions? Well, thank you so much for being here, and I hope you have a great day.